At the secondary school in Mabaruma, hundreds, including those speaking Spanish and the indigenous Waro language, showed up to receive basic medical care. Crossing from Venezuela to Guyana is easy. Many rivers present an easy route for those seeking a new life from the economic hardships they have faced in recent years. The regional healthcare system has been overwhelmed, so when it was announced that a medical outreach was happening, the large turnout was expected.
The growing number of migrants from Venezuela has really placed an increased burden and pressure on the resources which the country has to address and to provide basic services to the community: health, education, housing, water, a number of other services, right?
The medical outreach has been carried out by a team from the U.S. Global Medical and Surgical Support Group and a large number of local volunteer doctors, nurses and support staff. It was organized by the Office of the First Lady with the support of the Guyana Defense Force, the U.S. Embassy's Humanitarian Assistance Program, the International Organization for Migration, the Guyana Medical Relief and the Central Islamic Organization of Guyana, among others. The IOM has recognized the leading role Guyana is playing in support of migrants.
And the government really has, unlike a number of other countries in the region, the government of Guyana has shown great leadership and great solidarity, allowing persons to stay in the country and to integrate in the country. Many of these migrants are in really vulnerable situations, vulnerable conditions.
First Lady Arya Ali visited Mabaruma and expressed appreciation to the IOM for the work it is doing.
The International Organization for Migration has done very special work in this region in support of migrants fleeing the hardships of their country and trying to get them settled into a new life here. Their work is immeasurable, and I am pleased to express my gratitude to you for the incredible work and the key role you played in supporting and organizing this outreach.
The U.S. Ambassador to Guyana, Sarah Ann Lynch, pointed out that the government of Guyana has been clear that it does not discriminate when it comes to those seeking medical attention. The medical outreach has demonstrated the need in the region.
When I visited the outreach at Port Kaituma and I saw the number of persons going to have dental works, or persons who were there for ultrasound, persons there who were there for general medicine, I was taken aback and realized how much more we need to do as a region to provide more services to the remote communities of our region.
The U.S. Ambassador recognized the work the IOM and other UN agencies have been doing to ensure that those fleeing from hardship are not exposed to exploitation or trafficking, and she commended the local authorities for their work in seeking to ensure that the region remains safe and to ensure those who are living in the region can do so free from fear.
Venezuela continues to be the largest humanitarian crisis in the hemisphere. And since 2017, the United States has provided nearly $10 million to UN agencies to assist the migrant response in Guyana in the areas of health, education, and protection.
Regarding the healthcare situation, the First Lady said she was aware of the many challenges which prevent people from accessing quality healthcare in interior regions. But she said President Ali is committed to ending the inequalities in the country, and especially in a sector such as healthcare. She recognized that the cooperation of many persons and organizations is needed, as was evidenced from the medical outreach.
I want to recognize the tremendous sacrifice made in the resources and time by the local and overseas team of volunteer doctors, nurses, and other medical personnel who made this outreach possible. Your gift and your labor of love to the people of this region and the migrant population, including the indigenous Waro people, is noted and appreciated.
Reporting for the newsroom, Neil Marks.